In Patrick Robitaille, head of humanitarian affairs with Save the Children Canada. Patrick, thanks for being with us today.
Thank you for having me.
Your organization runs 2 health clinics in Gaza, treating malnutrition, providing supplies to children and mothers. Are you seeing any aid getting in yet?
Yeah, we start in general to see some aid coming in. There was even cooking gas, which is the first time that we saw this. So we are starting to see the aid to proceed. There's a lot of aid that have been cleared to come in. But what we really need to see is all of the points to be open and to see this pause to become a permanent ceasefire.
We've been hearing for months how dire the situation is for the people in Gaza. Can you paint us a picture of how it stands today?
Well, the situation is there's a lot of things that remains. People are still hungry. They have not received the aid. The big difference is that people are closer to home. So many of them have been able to go back to their communities, and the community is very important for resilience of people, but they find for most of them house destroyed and nothing really to still survive. So we need everything to be put back in shelters, as well as food, the medical system that is completely destroyed as well. So there's a lot of work, and there's a lot of traumatized people and children in particular that have lived horrific times in the last 2 years.
There is talk today that because not all of the bodies of the deceased hostages have been returned to Israel, that the Rafah crossing may not be reopened and that aid may not flow as it was intended. Any concern from your organization about that?
Well, definitely. I mean, the aid cannot be tied to a peace deal. This is international humanitarian law. This is what the children need to have, that the people need to have as basic humanitarian needs for their survival. So the needs are humongous, and we cannot see. This is the biggest crisis, humanitarian crisis that I've ever seen of my career. And we cannot go there with all our hands tied. We really need to have those access, those materials, those certainty as well, that we can work safely in all of the zone and access the people who are gravely in need.
In the last number of months, we've been talking about mere survival for the people of Gaza. But when you talk about the longer-term recovery and the rebuilding of these communities, what will that mean for your organization?
I mean, it's for my organization, but for the people in Gaza that, as I said, they are now in their communities. I mean, the first thing that we're thinking of, reunifying families and providing the basic necessities, but the longer-term education is one, and that starts today. We can remember when we were with the pandemic in Canada, how for us parents that had children, how important it was for them to have normalcy through going through school, throughout their friends. So that's to move from only protection sites that we're providing right now to actual education as much as possible. This will help a lot to start healing the wounds. And there's decades of work to do in terms of calming those trauma, but to intervene as fast as possible, that's extremely important. And obviously there's a lot of needs that will need people that have been that lost their limbs, that have been affected in so many ways, that needs a lot of medical attention and care.
Patrick Robitaille, head of humanitarian affairs with Save the Children Canada. Thank you for your time today, Patrick.
Thank you.